Dear ladies and gentlemen, dear colleagues, dear friends of the ITI, it's a pleasure for me to present Synchrotron radiation-based X-ray tomographic microscopy, the next level of imaging of oral regenerative biomaterials. 3D imaging is giving relevant information concerning macroscopic and microscopic structures, the architecture, the morphology, and characteristic hallmarks and features, as well as biomechanical, biological, and clinical properties of biomaterials for oral, soft, and hard tissue regeneration. In this context, scanning electron microscopy, SEM, has the advantages of high-resolution imaging and a high availability, a simple technique, and a sufficient cost efficiency. The limitations of this promising technique are that it is exclusively suitable for superficial structures that are exposed to the electron beam directly. It only allows the imaging and production of 2D images, and there is a lack of 3D data that can be used digitally for further data analysis. Next, micro-CT scanning has been widely used to visualize biomaterials for oral regeneration. The main advantages of this digital technique is that it is not limited to the superficial structure of the scaffold or the substitute,